Good afternoon, everybody. Today is May 6, 2022. My name's Scott McGann with the Falmouth Health Department doing a weekly COVID-19 update. Our email is health@falmouthma.gov, and our phone number is 508-495-7485. Case count-wise is 4,413 cases. These are all PCR cases, not home tests or probables, which are done at like Convenient MD in those places. So it's the ones that don't. This is just PCR. 82 PCR cases for the week. It's a pretty high number considering that most people are probably getting a home kit by now. 37 probable cases. Those are, again, not home tests. Those are somebody who might went to Convenient MD and got a rapid antigen test. Our 14-day incidence rate is 28.9, which is up from 26.80, and our positivity is at 7.31, which is pretty high at previously at 6.47. The case counts, again, starting in, early January aren't really, indicative of the actual count. So anything from 2021 back is either PCR was the primary way, or you could do the rapid antigen. Since then, home kits are. So when we had 370 or whatever cases in January, that was some multiplier higher than that. That's still the case. So I think the best way to look at this chart now is just to see whether the dots are going up or down, because it's going to indicate more positive PCR will indicate more positive home tests. And you can see that we've had elevated for now 4 weeks, and it was a bit higher from last week. So I would say that's the same trend that's probably happening with home tests. And also looking at, I still have like long-term care facilities and some businesses that will report cases of COVID to us, and they are reporting at a higher clip, not quite as high as we were seeing in January, but more like the surges that we had previously. So there's a fair amount of COVID out there, on the high side from what we would normally see. So I would say if you look at the beginning of the pandemic over, this is probably the second highest amount of cases that we were getting. Now, it is Omicron. We are vaxxed, boosted. Some of us are probably double boosted. It's not, in working its way to the hospitalization rates of, 50 or 70 or 50 or 40 or so forth. So, but we are seeing an increase in hospitalizations just because the sheer amount of cases will cause more of them. And when you have somebody who's immune compromised, even with a vax and double boosted, that even what would most people have as a mild case could be more severe. The vast majority of people, it's more of an upper respiratory. I'm sure you have family and friends and people in your circle that have had it recently. Most people that I have talked to, it's been mostly an upper respiratory, not like Delta, which got lower respiratory and got really COVID pneumonia and things like that. So more cases, again, case numbers aren't what's really important, hospitalizations are. And that's, up a bit this week as well. So you can see the trends here that the closer the dots get together, the better, but you can see that upward swing. You want it to be flat and close together. So similar to what we saw maybe right after the holidays, and then right before it's with that big Delta surge, you see it going up really fast and spread out. We're not quite at that, and not nearly at that right now, but we are seeing it up. So this week we moved to the high category because we did just trigger over the 10 admissions per 100,000. So that would be, since I think this is for the county, not for the town. CDC does things by county. We have nothing from the state on it. So, I'm flipping over to the CDC to give you their indicator. Now they generally have a very low bar. So it's I saw that last time that they do have, a difference, and states have a difference of opinion. The state hasn't adopted this and said this is what we're going to do, and we're going to have mandates based on low, medium, and high. It's just me to give an indicator based on what the CDC thinks. So we have about 225,000 or so people in the Cape, so 10 per 100,000 means there's somewhere around 23 hospitalized people that were admitted. Our percent staffed inpatient beds still stay pretty low at 2.5%. We're not going to get anywhere near close to 10%, but we did trigger it because we are over 200 cases, which means you cannot be green. You can be yellow or orange, and the cutoff is at 10. We're at 10.1, so we hit high. Now, coming over here, when you get to high, they talk about wearing, recommending a well-fitting mask indoors in public. State has not adopted this, so there isn't any mandates. I've also checked and looked at other towns right now. There are no, going back to mandates of any sort for masking. But as we get into higher, then you need to start considering your individual health status and situation and to make determinations for yourself. I'm just telling you, there's plenty of COVID out there. For the vast majority of us, the COVID's going to be an upper respiratory sort of head cold thing and go away. But if you're not in that situation and you have things like diabetes or a lot of comorbidities or things of that nature, then you need to consider that there's a lot more COVID going around right now. Like I said before, I'll talk about it when we get into the amount of, in another slide there further down. These are the moving averages for daily hospitalizations in the county. Slightly up, you see sort of an upward trend, but not anything like you saw in January for hospitalizations, daily and ICU beds being used. Still on the lower end for all of that. The cases, 4,376 is a pretty high count. Their positivity is well above 5. It's a 6.17. So that's on the high side everywhere in the state. The trends show it going up. Hospitalizations are going to start to go up just from the sheer number of cases. But deaths are staying relatively flat. Again, we have other things, not only the vaccine, you also have things like Paxlovid, which is starting to become more common, and if it's done within 5 days, it does wonders for somebody who's got, some harsh symptoms of it. So those are the things. So again, one of the things I'd say, I don't have a slide for Paxlovid, and so if you got COVID, you can talk to your physician. They could, I don't know it's all, how 100% on how available it is. It's been on the increase of becoming more and more readily available. But that's taken within 5 days is quite a good drug. So that might be something you would call your physician if you were positive with a home kit. Call your physician. You get hands on some Paxlovid. Maybe your doctor will do it based on your risk assessment of your risk, age, comorbidities, et cetera. Falmouth incidence rate was 28.98 on the high side. The entire of Massachusetts was 32.5. We were on the higher end. We had a lot of towns. Barnstable was a little higher. Bourne was a little lower. A lot of towns sort of fell on that upper 20s, mid-20s to upper 20s, and some towns out of Cape were a bit lower. Percent positivity, the county is higher. Massachusetts is at 5. Falmouth was at 7.31, sort of in that middle to upper end of the county. This is the one I was telling you. So this number, the number of people that get hospitalized that have been vaccinated, that number is really stagnant at 1.67%. It was 1.68 last week. So of all the people that get a breakthrough case, so there's been recorded 501,521 breakthroughs and a hospitalization of 8,387, 1.67%. So the risk of you going to the hospital isn't any different. It's just that there's more COVID going around. Also, the deaths are still at 0.45. I think it was 0.46 last week, so that's sort of hovering very stable. So, vaccinations have been highly effective and continue to be. So, if you haven't been yet, again, consider it. Second booster doses, nothing's changed. Anyone over 50 years old may get a second booster at least 4 months after their first booster. 12 and older can, 18 and over can, based on certain medical conditions. You can get it off the website, mass.gov. You can mix and match. So if you did 3 doses of Pfizer, you could do Moderna, vice versa. They're really recommending more the mRNA. They're getting away. I heard on the news yesterday that they're sort of weaning us off of the non-mRNA. Vaccine availability, as of earlier this week, there were quite a few slots open. I don't think people are waiting a long time going through the Vax Finder to find the pharmacies, the Convenient MD, the health centers, the health office, the community college, I think was still doing it. But just go on Vax Finder and schedule yourself if you want your second booster or your first dose to get started. Homebound, again, anybody who knows anybody homebound, especially as we're getting into the spring, you might go and notice a neighbor who's not doing as well as last year and they haven't been out of the house, and you talk to them and they're like, I've been looking for a vaccine. Call the health department, we'll schedule that. We'll have the VNA schedule that with you and come out and take care of that. Again, testing still at Convenient MD pharmacies, the hospital still is open, home kits are still one of the primary ways of doing it. Vaccination, I did not get a new slide. The states is still the 26th, so I don't have an update for this just because the state didn't produce it. I take this off the state's website, so I don't have anything to add on that. You can see the B, and this is this chart here just shows the variants. The original Omicron that was such a high case count in January is in dark purple, and that's sort of faded away, taken over by the BA2, which is now being taken over by the BA2.12. And these variants will just be waves, so you'll see the I guess you call that a red color, work its way up, the pink will shrink, the purple go away, and then, you know, the red will be taken over by something else, and we just have sort of these waves of Omicron-based and not Delta-based, which is good. Hopefully it continues that way and continues to get, you know, and continue to get more of the upper respiratory and the milder more Omicron in their variants. And over time, hopefully just continues to weaken out to, you know, where we don't get any hospitalizations or nearly none, and deaths. So face coverings, there are no, I think there's back and forth about I'd have to do some more research on it, about transportation of flying and so forth. They did lift it, but then I just saw something the CDC wants to re-implement it. I don't actually know where we stand right now. There are no mask requirements other than an advisory from the select board for town-owned property, you know, at this point in time. So as a recap, Falmouth case counts increased again this week, and the county itself moved to a CDC high based on their, what they consider high risk for the disease, you know, the burden of it, based on their metric. The state has not adopted any metrics, so there is nothing on the state that I saw today that would, and there's no direction being moved towards re-implementing things such as mandates at this point. There's plenty of vaccine and testing capability. Again, second booster doses available for 50 and over, or those that are under 50 but over 12 with certain comorbidities. There are no mask mandates in town. You have to look at your individual circumstances. I'm telling you today that there is a high, you know, a relatively high rate of COVID. Your outcome is probably going to be fine. It's not as it was back in 2020 and 2021. But you need to look at your individual circumstances and make a determination on your own whether you want to wear masks indoors or even outdoors. It's entirely up to you. But, you know, in high-risk situations and you feel more comfortable, then you, by all means, you can use a mask. There is a benefit to them. And so that's what I have for an update. We'll do another one again next week, and see everybody. Thanks.